The SEIU United Healthcare West, which is a union for private hospitals, says nonprofit hospitals are not spending enough money on charity cases. So they're proposing to Charity Care Act 2012, which would require a certain percentage of revenue be spent on free health care. 23 ABC's Christine Din has the details on what one charity case recipient has to say.
Tori Satterfield has been a caregiver for several years. One of her clients is David Mensch, who recently wheeled himself from Bakersfield to Sacramento to bring awareness to people with disabilities. But when 27-year-old Satterfield discovered she needed emergency heart surgery, she was the one who needed to be taken care of. Her hospital bill was $54,000, but her insurance would only cover $4,000.
I already worked 2 jobs. I would have probably had to got a third.
Satterfield says it would have taken her 30 years to pay off the surgery, so Memorial Hospital stepped in to foot the bill.
I was crying, happy tears. I had no idea that they were going to do that, so it's just a huge, huge relief. Thank you is not enough.
Well, we're a nonprofit hospital, and the mission and goal of Mercy and Memorial Hospitals is to care for every patient, to provide the best medical care regardless of who that patient is, where they came from, or how they're going to pay for it.
Nonprofit hospitals currently provide free health care in exchange for not paying taxes.
But they set the amount, and right now it's very low.
SEIU UHW says nonprofit hospitals on average spend between 0.9% and 2% of patient revenue on charity cases. But the union's proposed Charity Care Act of 2012 would require nonprofit hospitals to spend a minimum 5% of revenue on charity care.
I mean, well, what it would do is infuse millions of dollars for health care and preventive services into low-income communities, and that is way more affordable for taxpayers than costly emergency room care.
Not everyone agrees. San Joaquin Community Hospital, which is a nonprofit, issued this statement about the Charity Care Act, saying, quote, "If these mandates are enacted, SJCH and other nonprofit hospitals would be unable to move forward with new initiatives that ensure the continued health and prosperity of our communities. Though these ballot initiatives are presented as having the consumer's best interest in mind, in reality, they center on forcing non-unionized hospitals to allow unions to form in their facilities." End quote. Now, the Charity Care Act is in the signature gathering phase and will have to collect 505,000 signatures to qualify for November's ballot. For more information and to read San Joaquin Hospital's complete statement on the proposal, you can go to our website, turnto23.com, where you'll find a link to Yes for a Healthy California. In the studio, I'm Christine Din, 23 ABC.